So I'm going to be talking to you about the laparoscopic sleeve gastrectomy. It's also known as the lap sleeve or just the sleeve. This procedure is one of the most popular operations that I do for good reason. It has excellent weight loss. It's a relatively easy procedure to get through. It takes me only about 45 minutes in the operating room. And with half an hour to go to sleep, half an hour to wake up, we're talking about an operative time of somewhere around an hour and a half to 2 hours. Most patients find that appealing. They also like this operation because it doesn't rearrange the intestines like so many of the other bariatric surgery operations do. So we're going to talk a little bit about the procedure, how it's done, what to expect after the operation, what weight loss is going to look like, and how much weight you can expect to lose from the sleeve, as well as some caveats of this operation. Just so you know, if you have severe uncontrolled heartburn, this operation may not be for you because it can increase after surgery. So in a laparoscopic sleeve gastrectomy, I'm going to draw a little picture and explain where we are. This is your esophagus. That's the tube that carries food from your mouth down into your stomach. This is the diaphragm, the muscle that helps you breathe. Your stomach looks like half a heart and then comes around to the rest of your intestines over here. This is pretty high volume territory in terms of a lot of different organs in this area. So you have the lungs over here and here. You have the heart that sits on top here. You have the spleen that sits over here. The pancreas is over here. This makes insulin, but also puts in digestive enzymes to help you digest food. Your liver sits on top of all this, but for simplicity's sake, I'm going to draw it off to the side over here, and your gallbladder is over here. In a laparoscopic sleeve gastrectomy, we put down a tube of a set diameter. That's so that you know and we know exactly how big around your future sleeve is going to be. We then take a surgical stapler and staple off this portion of the stomach. This part comes out of your body, never to be seen again. You lose weight for a couple of reasons. The first is your stomach is 90% smaller. The other reason that you lose weight is this part of the stomach makes the hunger hormone called ghrelin. Patients report that after a laparoscopic sleeve gastrectomy, their stomach growling hunger as well as their drive to eat is decreased. When we do the operation, if this is your rib cage and this is your sides, this is your groin, and this is your belly button, we do the operation through 5 teeny tiny incisions. So 1, 2, 3, 4, 5. This one's a little bit bigger than the rest, and that's where we take the stomach out. It's also where we close the muscle with stitches, so it does tend to be the one that hurts a little bit more. After a laparoscopic sleeve gastrectomy, most patients spend at least 1 night in the hospital and go home the next day after surgery. However, if you're feeling great, your pain's well controlled, you're taking liquids, you are allowed to go home the same day as your surgery. Most patients do need 1 extra night in the hospital. Of course, we always customize our program. If for some reason you're not feeling well, things aren't going well, we will keep you for an additional night. So generally, 1 night after the operation, in some cases 2 nights after the operation. Most people want to know what the recovery time is like afterwards. The first 3 days are rough. You're going to be sore, hurting. You're going to be trying to figure out your diet afterwards, making sure that you're getting enough liquids. After the first 3 days, people do say they tend to get better and better every day. By the end of the first week, most people are making short jaunts, either out to the grocery store for 2 or 3 items, or to the pet store to pick up 1 item. You can drive once you've been off of all narcotics for 24 hours. Usually by the end of the second week, people are feeling pretty good and are ready to go back to work at 2 weeks after surgery. By about 1 month after surgery, most people say that they're back to 110% of their usual self and have much more energy than they did after surgery. If you do work that involves heavy or manual labor, you may want to consider taking 4 to 6 weeks off of surgery. But again, we understand that your life and your work is customized to you, and we will work with you to create a program that's right for you. Most patients want to know what their diet's going to be like after surgery. For the first few weeks, your diet's usually pretty limited, so the most important thing is to make sure that you get adequate water. Generally, I recommend that you get 64 fluid ounces. That's 2 of those really, really large cups. Usually, by measuring cup size, 8 cups of water a day. It's going to be impossible for you to drink all that water at once or even gulp it after surgery, so it's real important that you take constant sips and always have a water bottle by your side. After that, the diet's pretty limited and includes protein drinks, sugar-free jello, sugar-free pudding, broth, as well as Greek yogurt. After 2 weeks, we do advance you to soft, mushy foods. You're on that for 2 weeks, and then at 1 month after surgery, we do advance you to regular foods. In terms of weight loss, people often want to know what sort of weight loss they can expect. So it's based off of something called your body mass index and your excess body weight. You can go to www.luminbariatric.com and look up our bariatric surgery calculator on the front page to find out how much weight you will lose with a sleeve gastrectomy.